Hello, viewers and listeners. You are welcome to another episode of the program Midday Vibes, coming your way from Caliphate TV on Star Times Channel 141 and Caliphate Radio transmitting on 91.9. I am Hajara Usman Attajri, your uncle for the show. In today's episode of the program, we are going to discuss about the health risks associated with Harmattan season and how to stay safe, with a focus on pneumonia. What are the common symptoms, preventive measures, and treatments of pneumonia? Joining me in the studio is Dr. Anas Sahabi, a specialized health practitioner from Infectious Disease Hospital, Anamawa, Sokoto State. You are welcome to the program, sir.
Thank you very much.
Dr. Anas, can you tell us what are the common diseases and infections that people are more likely to contact during this Harmattan season?
Assalamu alaikum wa rahmatullahi wa barakatuh. As I was first introduced, I stand by the names of Dr. Anas Sahabi, medical officer from Infectious Disease Hospital, Amanawa, Sokoto State. Harmattan season is a season that we normally see as a season of wind and dust. So, and it also brings us to more risk factors in contracting diseases, mostly respiratory tract infections, which most of them are being transmitted through aerosol. What I mean is through respiratory droplets from an infected individual. And this disease, a wide variety of diseases, ranging from diseases that we can that can affect us from bacterial causes. We have the viral causes, the fungal causes, and many more to mention.
So, is pneumonia a significant concern during Harmattan?
Yes, of course. Pneumonia is a significant disease of interest in this season. Why? Because if we look at the respiratory system in general and the way diseases affect the respiratory system, most of them, after being contracted, if not being treated well, most of them may progress to pneumonia. Before we go further, I think we should have a hint on what pneumonia is.
Yes.
Pneumonia, from a, let me say, layman language, it is the inflammation of the lung tissue. So, inflammation of the lung tissue, which mostly affects the alveoli. And that's where the exchange of air and blood occurs. So, we need oxygen to be transported into our body, mostly the brain, the heart, and other tissues. They need oxygen for them to perform duties. So in this case, the oxygen blood exchange, which we call perfusion exchange, is being impaired because of the effect on the alveoli, where the perfusion normally occurs. So after that's the, let me say, brief of what pneumonia is. Yes.
Okay.
So, and what can occur after having the pneumonia.
So, who is most vulnerable to malaria during Harmattan?
So the most vulnerable group, to be specific, are the children, mostly children under 5 years of age.
Okay.
Those are the ones that are most vulnerable to the pneumonia, especially in this season. Though, as I have mentioned before, there are many causes of pneumonia, but in this season, mostly our cause of pneumonia is bacteria and virals. So the bacterials mostly also being transmitted through aerosols, and the virals also being transmitted through aerosols. So the children under 5 years of age, and mostly the males,
Okay,
the male
male
child,
children.
yes, the male child. Why? Because their immune system is weak,
Weak.
is not fully developed.
The males. So you mean
No,
that
not the males, the children
the
under
children
5 years
under
of
5,
age.
yes.
Yes. So their immune system is not fully developed. As we can see in other risk factors of pneumonia, we have the immunosuppression, or let me say, the weak immunity.
Okay.
So that's where the children under 5 years of age comes in. And to be more specific on males is that, when you look at the male child, most of the times, male childs are more active than female child in terms of playing
Yes,
and
a rough
whatever,
player,
the mingling and whatever.
Yes.
So that's what prompts them to be more at risk on having pneumonia disease. Yes.
So what are the most common symptoms of pneumonia to watch out for?
So the most common symptoms of pneumonia to watch out for in this case actually varies.
Okay.
It varies
Can you
because,
mention
as we
few?
said, children under 5 years of age. So even a child of 1 year can have pneumonia. So that one cannot speak out what he or she is feeling.
Yes,
Unlike a child of 5 years, that child of 5 years can speak out. The symptoms we are referring to what the child or what the caregiver of the child will tell you are the problems of the child.
Yes.
The signs are what you will see on examination. So the symptoms mostly for children under 2 years, those ones cannot speak out. They cannot tell you that I'm having headache, I'm what, they cannot tell you. So like it's the mother that will see, and also that depends on what you see as a health practitioner. So those ones, the most common ones that they present with is, of course, is fast breathing.
Okay.
Yes. You as a mother, you know that, yes, my child has been breathing well for quite some time, but unfortunately, 2 days back, or just yesterday, or of recent, the child breathing is becoming faster and faster. He's not breathing well. So that is breathing difficulties. The child will have breathing difficulties. He may also present with cough. See a child coughing. Unlike maybe, let me say, in cases of choking, maybe he's breastfeeding. As he chokes, then he will cough, and that one will stop. But for the case of pneumonia, the child will repetitively be coughing always. And in some aspects or in some cases, child may not present with cough. It's fast breathing and fever. Hotness of the body. Yes, his body is getting hotter and hotter. We've been taking him to the chemist. They gave him cough syrup. They gave him paracetamol. However, the cough is not going, or the fever is not going. Yes. So those are the most common ones.
In children.
In children, yes.
What about an elderly person?
In elderly childs, those ones, those are the ones that can speak out. So they may tell you that as I'm coughing, I'll be feeling pain, chest pain. Okay. I have chest pain, I have headache, all my body, I'm not feeling normal. I cannot eat well. I'm weak. I'm what? So those ones. Also older child can also mention those ones. And then when it is severe, a mother can tell you that this child has convulsed. This child has convulsed maybe once or twice. The mother will tell you. Or maybe he is not eating at all. The child is not eating. Yes, he's not eating. I've tried to breastfeed him, he's not. Give him pap, he was not drinking. He was not taking anything. He's lethargic. Like he is weak, totally weak. The child cannot do anything.
Because
So
our listeners might not get
yes,
it. Eh?
yes. So that's why I always try to bring it down to our understanding.
Yes.
Yes. So the child is not eating at all. The child is weak. He's not even playing with his peer group. Maybe they will come, Abakar, come let us play. Abakar will not even look at them. He is the only one who knows what he is feeling inside him. So in those cases, we always request that caregivers should rush the child to the hospital instead of staying at the nearby chemist. Let them take him to the hospital for proper assessment and treatment. So I think based on the symptoms and signs, I think we have said something.
Yes. Okay, listeners and viewers, it's still your show, Midday Vibes, coming your way from Caliphate TV on Star Times Channel 141 and Caliphate Radio, transmitting on 91.9. Harmattan increase the risk of respiratory diseases in general or infections. So, how does it increase the risk of pneumonia?
So, as it was said in our discussion, pneumonia, it is a broad term, or let me say, it is a effects of the disease that affects the respiratory system when not treated early.
Okay.
Yes. So there are many causes of pneumonia. And risk of having this pneumonia is very high in this season. Why? Because this is a season of dust, wind, and everything. And of course, the temperature is very low. So, and most of the viruses and bacteria prefer this kind of temperature.
Okay.
Yes. So they prefer it. That's why whatever you do, in one way or the other, you must come across them. Only that if you have good immune system, at least your immune system will fight it. So in this season too, we have measles. Measles can cause pneumonia if it affects the respiratory system. Those are among the complications of measles.
Okay.
Yes,
So
you will see a child with
cause
pneumonia. Yes, you will see a child having all the classical symptoms of measles.
Yes.
And the child is coughing. The child is having serious temperature.
Yes.
The child is not eating well. So that means the measles virus has already go deep down into the respiratory system and it affects the alveoli, where the main thing occur. So that's it. And then we have the bacteria.
Okay.
We have the Haemophilus influenza. And we have the strep. We have, but at least these ones that I mentioned, I think they are preventable. Because I think we have vaccines for them. If at all, our people will go for the vaccination. Because I know the myths that are going around on vaccination. So, why pneumonia is at higher risk now is that because of these respiratory infections. You have common cold if not treated well. It can result into it. Yes. It can lead to it. Just a common cold. The child has been having this catarrh and whatever, but it was not taken care of. So and disease always progress. They progress.
If not treated.
They progress. So mostly, those are the diseases that causes the pneumonia. Pneumonia is not a disease entity, but it is the effect of the disease entity on the respiratory tract. I think.
So, how does pneumonia manifest in different age groups?
So, the manifestation of pneumonia in different age group, these ones, I think we have made mention of some when we were talking of signs and symptoms.
Okay.
Yes. So, it differs from the young child, older child, and adults. So, the manifestation differs. So in younger child, what we mentioned is the higher fever, inability to eat, and then sometimes, if serious, convulsion, weakness of the body. All those ones, if you see them, please think of
You know,
that.
once they notice those signs and symptoms, they'll just conclude it's malaria, it's
It is,
malaria.
yes, actually, that's the big myth. You say, it's the cough that turned to malaria.
Yes.
So I think those are the things that needs to be changed in our group, in our people, Gaskia. So that's for the younger child. Then for the older children, those ones they can talk. They can tell you that I'm having difficulty in breathing. Mommy, I cannot breathe well. Mommy, I'm coughing. Mommy, I'm having headache, body pain, weakness. I cannot eat well. All those ones, they can also present with it. And even the convulsion, they can present with it. Sometimes in serious, severe pneumonia, patient may lose his consciousness. Yes, you see a patient lying unconsciously. They will bring a child to the hospital unconscious. So those are among the serious signs that do manifest in children with pneumonia if not being treated early. Then for the older group, of course, even me, I can have pneumonia. I can have it. So, but for adults, mostly it's straightforward. He will explain to you. Though our people are, let me say, bad history tellers. They cannot tell you what exact their problem is. You can ask him, what is your problem? I have malaria.
Yes,
that's it. He has already concluded that it's malaria.
It's malaria.
He coming with his cough, fever, and whatever. You write for him the antibiotics, and the guy will tell you that you didn't put anti-malaria. And I know I have malaria. So those are the things. But for adults, mostly is the cough, fever, headache, then the weakness of the body, which we can say maybe malaise or lethargy, those ones. So for adult canon, those ones can present with that.
All right, viewers or listeners, it's still your show, Midday Vibes, coming your way from Caliphate TV on Star Times Channel 141 and Caliphate Radio transmitting on 91.9. We will take a short break and we will be right back. Please stay tuned. Welcome back. If you've just joined us, this is Midday Vibes coming your way from Caliphate TV on Star Times Channel 141 and Caliphate Radio transmitting on 91.9. And right here in the studio is Dr. Anna Sahabi, a specialized health practitioner from Infectious Disease Hospital, Amanawa, Sokoto State. You want to be part of this conversation? The number to call is 090 60002022. Dr. Anas Sabi, can you tell us what are the most effective ways to prevent pneumonia?
Okay. Basically, the effective ways of preventing pneumonia, I think generally we prevent the risk factors. So what are the things that put us at risk of having this pneumonia? So those are the things that we watch out and prevent them. One, proper immunization.
Okay.
Yes. So our children should have this the pentavalent immunization and the pneumococcal conjugate virus, also conjugate vaccine. So, and I think those ones we do receive 3 doses from 6 months, then ever after a month until when the 3rd dose is given. Then,
okay, when is the 3rd dose given?
It does ever after a month. So if we give at 6 months, ever after 4 months,
Okay.
So we give at 6 months, then at 10 months, and again at 14 months. Yes. So after that, then we also immunize our children against measles. Yes. So the measles are given 2 doses. So when a child receives these vaccines, at least, even if he is to contract any of these disease, it will be a milder form.
It should not be severe.
It will not be that severe. It's a milder form. So that is for the vaccine preventable ones. Then, of course, the BCG, which is given at birth, that's for pulmonary tuberculosis.
Okay.
I told you that pneumonia is something that wide variety of diseases can cause, which TB too is among.
That is
Tuberculosis, yes. We have the tuberculosis pneumonia.
Okay.
Or let me say mycobacterium pneumonia. So those ones. So after giving the vaccines for those ones, then of course the other preventable ways is use of face mask. Yes. So at least it is shown that use of face mask decrease the risk of contracting these diseases, because most of them are being contracted through respiratory system. That is through inhalation. So if you put your face mask, at least it will reduce the dose of the bacteria or the virus you will inhale into your body. So that one, use of face mask. Then again, staying healthy. That is eating balanced diet. Anything that will weaken your immune system, just avoid it. Because low immunity is among the things that make people vulnerable to any kind of disease. So if your immune system is good, then at least against any infection. So how will you make your immune system to be good? That is eating good, healthy foods.
So how effective is masks in preventing pneumonia transmission?
So at least we cannot say 100% effective, but at least it reduces the risk to about 60 to 70% of contracting it. So, and it is advised that both the infected and the non-infected people should wear it. The infected one, after wearing it, that means even if he coughs, everything will be in him. He will not spit it out.
Okay.
And for you that you're healthy, when you are inhaling, you will not inhale that higher doses. It's just a small dose, which your immune system can curtail and fight against it. Then, again, issue of eating balanced diets. This malnutrition is among the risk factors of having any sort of disease. So our children that are at risk of malnutrition are still those ones below the age of 5. So mothers have to try their best in seeing that their children stay healthy and also eat well, for them not to be malnourished. Because once your child is malnourished, let me say, you are in serious problem, because any sort of infection, anything, small thing, will affect your child. That's why they are
complaining of high food prices and other things. So are there any affordable foods that people can use to boost their immune system?
There is nothing like that. It's what we eat. Your child
say they cannot afford to buy egg, they cannot afford to buy milk. So are there other like fruits that people can use to help boost their immune system?
Any sort of fruit you can use, but that one will not even do much.
Okay.
Yes. This pap that you see, the soybeans pap, mixed with this millet, with sorghum, with granite and everything, I think is the best for children. Just make it for them. At least you cannot say that you cannot afford a fish of 1,000 in a month.
Yes.
Or let me say in a week. 1 egg in a week, you cannot afford. So that's something serious. So at least once in a while, it's not always, once in a while, buy egg, fish, meat. Then this pap, prepare it. Then of course you too, you cannot be taking care of your children without you yourself.
Yes.
Mothers have to stay healthy too, for them to cater more for their children. Because if you're sick, that means everyone is sick in the family, including the father. Yes, because you are the one taking care of them. So you have to stay healthy for everyone to be healthy in the family. So at least that one, always try to maintain good balanced diet.
So how is pneumonia typically treated?
So for treatment of pneumonia, mostly for you to treat pneumonia is not ideal to keep your child at home, saying that you will treat it at home. There is nothing like pneumonia treatment at home. Or maybe you will take your child to one nearby chemist. The chemist guy will just bombard you with cough syrup. Yes, he'll give you different sort of cough syrup. Use it. He is coughing. Cough syrup. Most of them didn't know, but some of them are using it as a business. Someone is having bacterial infection and you are giving him pneumonia. It's like someone having fever, you're always giving him paracetamol. Paracetamol will just reduce the fever, but it will not treat the cause of the fever.
Yes.
And in medicine, what we believe in is treating the cause, not the symptom.
Okay.
We treat the cause. So that's why it is always advisable to take your child to the hospital for proper assessment and evaluation. Take him. It's the doctor or the health care personnel will decide whether the child will be admitted or the child will be given medications to go and use them at home and later come back for follow-up. But the cough syrup the chemist guy will give you, it will just affect your mental health of the child, the mental health of your child. Why? Because even we, let me say, personally me, if I take any of the cough syrup for that whole day, I'll be useless.
You'll be weak.
Yes, I'll be useless. I cannot even do anything. Yes. Everything, my brain will be somewhere. I'll be, like, my activity will be diminished. So as you repetitively give your child those syrup, like let me say for 5 days, for 1 week, you always cough, you take him to the chemist guy. Some of these are viral causes. Some of the viral causes are self-limiting. They will come, but as you are giving your child healthy food and everything, you are taking care of the cough, then it will go. You don't have to take him for the cough syrup and whatever. No, just suit the throat of the child. Clear the nose and whatever. Make sure that the nose is moist, not that dry. You can use Vaseline and put it on the nose. It's okay. So let the air be humidified, not that dry. Because the dry air can also cause the constriction of the bronchioles, which will in turn cause the inflammation. And from there, you will see pneumonia coming in. So that is the one. But the cough syrup, it will just affect your child in terms of mental well-being, one, and then also capability in learning. Those are the ones that you will see. At least you have to repeat things for more than 10 times for him to get. Just alphon or just ABCD. You will spend the whole week teaching him ABCD. Because the cough syrup has already done its effect on the child. So the neurons are no longer responding well because they are weak. The antitussives given to the child, those are the cough syrups, they have already diminished the function of the neurons. So that's it. At least take your child to the hospital. The caregiver, or let me say the health personnel, will assess. After the assessment, then he will see any of the danger signs that are there. Is there any danger sign? If at all there is a danger sign, if he is capable of admitting your child into his facility, he will admit him and manage him properly. Like a child with convulsion, or a child who is very weak, a child who cannot eat, always crying and whatever. So those ones, even you as a mother, if someone tells you that take your child back home and treat him there, you will not agree.
Yes.
You will not agree. And the chemist guy will just give you the cough syrup and tell you that go back, your child will be better. But those are the children that needs proper evaluation, investigations needs to be done. And after the investigations, then proper medications to be given, but not cough syrup. When a child comes in with just milder symptoms, that is a simple pneumonia, of course, the medical personnel will give you maybe the appropriate antibiotics. And then maybe if at all the child needs other things that will help him in respiration, he will give. And before you know, just 1-2 days, the child will pick up and he will be fine. Why? Because the main causative agent is being taken care of. So I think that is basically seeing all those signs and symptoms that we've mentioned.
Yes.
Take your child to the hospital for proper evaluation.
Okay.
After the evaluation, the health personnel will tell you what needs to be done at the right time.
Okay.
I think that is it for that.
So thank you very much, Dr. Sahabi Anas, for sharing your thoughts with us and for honoring our invitation. With this, we come to the end of today's episode of the program Midday Vibe. On behalf of our production crew and our guest, Dr. Anas Sahabi, I am Hajara Usman Attajiri saying stay blessed and keep watching Caliphate TV on Star Times Channel 141 and Caliphate Radio transmitting on 91.9.